so to field questions from the audience. There's a mic that's being passed around, and then mics on either side of the room. So don't everybody jump in at once. We'll take questions from the floor. Question in the front.
Yes, I had a question for Dr. Lochner about food choice. And the last point you made had to do with mindless eating, or one of the last points you made. Mm-hmm. And you said that behavioral economics may need to be looked at for interventions. If the goal is to try and get older people to eat in a more healthy way, yet food choice seems to be so cemented at such an early age, what kinds of research should you look to try and modify behavior? There is that notion out there of choice architecture, where you have an environment that makes it difficult to opt for unhealthy changes or unhealthy behaviors. Is that what you're talking about when you talk about behavioral economics?
I think I'm talking about it even more so than that. So, for example, in Dr. Yen's presentation, can y'all hear me?
Sure.
What am I doing wrong? Sorry. So I'm talking about it in multiple spaces, ranging from the home environment to the larger community environment, as well as things that policymakers and industry does. And so, for example, some of the work that Dr. Yen is doing, she pointed out how the presence of the fast food restaurants in an environment makes one more susceptible or likely to frequent those establishments. But people can make very simple changes within their own home environment by having food located in certain places within their refrigerator, whether it's on their countertop and so on. But I think that one of the most exciting things about this IOM workshop for me is the inclusion of industry and things that industry can do, and the government working together, which is why I posed that question to the first speaker this morning. So to the extent that people do not have to make choices and that they have to opt into something, or have to opt out, I think that that's really the way to go. When we do our studies, sometimes we ask people if they want to participate in studies where they would get free meals after discharge from the hospital, and there are so many people who refuse to participate for a variety of reasons. What if those were standard? Some of the work that Dr. Gunterson is doing, where what if we made SNAP available to everyone who was eligible instead of having the burdensome process of having to apply? Things like that. Yeah.
Thank you.
Mm-hmm. I'm sorry I took so long. Yeah.
Other questions from the floor?
So along the lines of the behavioral economics, I thought I had this. Yeah, along the lines of the behavioral, I was wanting to ask Craig about the don't limit what people can buy with SNAP comment with the Gatorade for the grandchild. So I heard where you were coming from, the patronizing piece. On the other hand, Gatorade for the grandchild is really not a great idea. So do you support the idea of taxing sugar-sweetened beverages? Are you allowed to comment on that in your capacity? You have a...
I'll back you up in whatever you say, because I agree.
Just as long as you don't ask me about soybean policies. I can speak about other things, though. Okay, here's the thing is, let me get started with this, is that we pose a lot of... Americans oftentimes feel comfortable telling poor people what they should and shouldn't do with their lives. Poor people are oftentimes treated in ways that we would never treat other people in our society. So, for example, when I used to work for USDA, nobody in the government thought to tell me how I could use the money that I got from the USDA. Every year I get this mortgage tax deduction from the government. Nobody tells me how I can spend that mortgage tax deduction, right? Why do we think it's appropriate to tell poor people what they can and cannot do when we try to give them a helping hand? It's patronizing, it's condescending. Instead, let them make their own choices. And if you look at what people spend amongst low-income households, it's not that much different than the rest of society. The main challenge poor people face is they don't have enough money. you know? And so it's really, really important that we not patronize and treat poor people like they're children, especially, you know, across all ages. So no, I think it's an awful thing, and this is, so, anyway, so that's the first point. The second point is regarding taxes. I think we have to be really, really, really careful about this, is that, first of all, the first thing is if you look at the evidence on soda taxes and all these things, basically zero change in people's behavior. So it's in part because the demand curves for soda is pretty inelastic. At any rate, taxes don't seem to have any impact on anything anyway. So it's a silly policy anyway. But if people are going to put these taxes on, who does it hurt the most? It hurts poor people the most. Taxes on food is extraordinarily aggressive. If you want to put taxes on, if you want to punish poor people, raise food taxes. That's the best thing you do. Raise whatever, over whatever dimension is. First of all, if you raise taxes on, let's say, Gatorade or whatever, you're basically making no impact on obesity or healthy food, quote unquote, however we want to define that, of course. But you're also making poor people worse off. So if your goal is to increase food insecurity in the United States and increase hunger in the United States, support soda taxes. If your goal is to help poor people, don't support them.
Do you have one more question? Or a couple more questions? Great.
Yeah, I just wondered if there's been any studies on participants of SNAP Ed and incidents of food insecurity.
Here.
Thank you for asking that, because Jim Ziliak and I headed up this research on childhood hunger program that was funded by Food and Nutrition Service, and we funded a project that was done by Heather Eicher Miller, who's at Purdue University. Some of you, well, you may know her. I don't know if you know her, but anyway. So she did a study looking at where she gave some people information on financial planning practices and other groups not. And what she found was that those who got the information on better financial management skills had reductions in food insecurity in comparison to the control group. SNAP Ed, I'm not that familiar with SNAP Ed at all. It's outside what I do work on. But these policies, if we can encourage better financial practices through programs like SNAP Ed, that led to reductions in food insecurity. I'm not sure about the broader program, but at least in terms of teaching about financial practices, that seemed to help out.
I have more of a comment than I do a question, kind of piggybacking this idea of taxing soda. The reason that we're here as a society, I think it's really important for us to look at things historically, especially as they relate to the poor. Not that all poor people are ethnic minorities, but we can say that people that are different that come to this country are asked to behave, are, kind of muscled to behave a certain way to fit. Part of that muscling is about food. And so we've told populations, what you do is not good enough. What you eat is not good enough. I can say that specifically in regards to the Mexican population and Americanizing the Mexican population to eat wheat diet and do a lot of things that they were not acclimated to do at that time in order for the food colonialism, so to speak. And now that they've adopted that, now they're pathologized for being obese and having diabetes. And so it's like you can't win. So I think that taxing food and trying to put an agenda against the poor is just another way to contribute to the debasement and marginalization of different people. And that's what I would say about that, because I think we need to be against that, not for that, and realize that a lot of that is contributing to the obesity problem here.
So could I please just follow up on that? So I think that many of the people in this room are health researchers, and so for them, the focus is on health outcomes. As a sociologist, I recognize that people consume food for many reasons other than just physical nourishment. So food is nourishment also for the soul, and people eat as a way to express their cultural identity. And so I think what you all are talking about with respect to SNAP extends to other programs as well, and having rules about what one can consume in places like nursing homes or what can be served as part of administration on aging programs fall under that umbrella as well.
The red light's flashing, so I think we can call the session to a close. Thank you all so much for your time, your attention, and the great